If you are over 50, you want to hear the answer to this question. Absolutely. So I hear this question from so many of my professional women leaders. They're out in the trenches, they're doing the professional work, they're digging in, they're leading teams, they're leaving a legacy. And this question comes up all the time. So the question is, would you recommend hormone treatments for post-menopausal women? Well, absolutely, because menopause is that 1 year after the last menstrual period, and that is exactly when we want to be using menopausal hormone therapy. Now, I think this question might be alluding to what if I'm past that? Have I missed the boat? Let's talk about that a little bit. We know that menopausal hormone therapy is on label for hot flashes, night sweats, vulvar-vaginal or vaginal dryness, irritation, bladder symptoms, vulvar-vaginal symptoms called genital urinary syndrome of menopause. We know that when you're in the early stages, even the perimenopause or early menopause, menopausal hormone therapy is appropriate for a lot of women, and it has a lot of benefits in addition to what it's on label for because it really mitigates that estrogen decline. We know that it helps protect bones. We know that it has some benefit in all of the organ systems that potentially need estrogen. I'm thinking brain, heart, skin, vagina, all those things. Now it's on label for hot flashes and night sweats, genital urinary syndrome of menopause, bone protection, but it has a lot of other benefits. I think this question, however, is like, what if I miss the boat? What if I'm 60? Remember, menopausal hormone therapy can be started or very safely started within the first 10 years of menopause, usually under the age of 60. What if I'm beyond that? If you're beyond that and you're having symptoms, absolutely talk to your healthcare provider about menopausal hormone therapy because it's going to help with those symptoms if it's still safe for you and having an informed conversation because there may be a slight increased risk of stroke or heart disease if you haven't been on and you haven't had estrogen in your body and you haven't been on medication for that in over 10 years, sometimes reintroducing it can create some of those cardiovascular risks. So, talking to your doctor about that. But it is often okay to start menopausal hormone therapy. What it really comes to mind when I hear this question is about 3 to 5 years after menopause, a lot of women start to have vulvar vaginal changes. So, changes in the tissues. Changes in the vulvar vaginal tissues actually starts right around perimenopause and menopause when the estrogen declines. But the symptoms really kick in several years after menopause, and especially in this over 60, 10 years past menopause category. And at that point, it is really, really important to locally manage those changes in the tissues. How do you do that? Vaginal estrogen, estrogen cream, oral medication called ospemifene that will locally target the vulvar vaginal bladder tissues. And there's a intravaginal steroid that can be used as well. And then there's over-the-counter vaginal moisturizers that can be used very regularly. They're mucopolysaccharides and they stick around and they're non-hormonal, non-medicinal, non-prescription that can sometimes help with vulvar vaginal tissues as well. So don't delay. But if you're in that delayed category, you have not missed the boat and you need to be seeking treatment for any symptoms you might have and to be having that conversation so that you can get on the treatment that may be really helpful for you.